Welcome to New Hampshire's Business. I'm Fred Coker. What are the drivers of your health and your family's health? It's critical. It's a critical subject that's about to be examined by health and public policy advocates at a major symposium in Manchester. This statement describes the issue, with evidence suggesting that meeting patients' social and economic needs can reduce the demand for costly or avoidable health care and generate savings. Now, payers, providers, and policymakers are trying to do more to address the drivers of health in clinical settings. So the bars in this graph represent common social needs that are shown at the bottom, and the percent of physicians and other personnel in their practices is shown at the top, who often screen patients for social needs. With me to put a focus on this in New Hampshire is Courtney Tanner, the Senior Director of Government Relations at Dartmouth Health, based in Lebanon, with community hospitals and clinics across northern New England, and Bob Dunn, Director of Public Policy at the Roman Catholic Diocese of Manchester, including Catholic Charities of New Hampshire. I note both of you are lawyers, right? Welcome, welcome. Courtney, you represent Dartmouth Health. Bob, you represent Catholic Charities. Are the social and economic needs that you're both looking at the same, or are they different?
Bob, do you want to take that one first?
Courtney?
Sure.
Yeah, go ahead, Courtney.
I would say that we certainly want to make sure that our patients are as healthy as possible and as safe as possible. So there's a lot of commonalities in what Bob and I are doing to represent the citizens of New Hampshire.
Bob.
We're really focused in on what happens in the state budget on Medicaid. As you know, Fred, a big chunk of the New Hampshire healthcare system is dependent to a significant degree on what the legislature does with respect to Medicaid funding. Mm-hmm. And so that decision in the budget is something that really tells the tale to a significant degree about whether New Hampshire is going to have a health care system that is going to be robust and effective, right, and is going to allow for New Hampshire individuals and businesses and families to flourish.
So even though it says Catholic Charities, you have a health focus. You both have a health, well, obviously you do, but you have a similar health focus. You both focus also on public policy, as you just said, and government, and your organizations are looking at decisions in the year coming up, 2025, on health, both of you, either in New Hampshire or in Washington. What are you looking at specifically, Courtney?
Yeah, Fred, you showed a graph that showed social needs that we have in New Hampshire.
Right.
And we also know that there are governmental structures and policies that allow for services to be delivered or impede access to services that address those social drivers. And so we're really excited to host this forthcoming symposium on Monday, on December 16th, to start to explore how are patients getting to the right care at the right time. Do they have adequate housing? Is there adequate child care in New Hampshire? So we're really starting to talk about what are the policy levers that we need to be pushing and pulling in New Hampshire.
Right.
What investments do we need to make to make sure that we all have access to the resources that we need?
And Bob, you're going to be on one of the panels. So what about that? What are you looking at next year in the New Hampshire legislature, perhaps?
Well, the most important thing, I think, as far as healthcare is concerned, is going to be the budget, obviously. And in the development of the budget, we're hoping that it's going to be rooted in human dignity and the common good, the basic principle of the common good, which isn't just a religious principle, but it's the principle that's at the heart of the body politic as well. The very first article of the New Hampshire Constitution says that government is instituted for the general good. And so when we start talking about political determinants of health, I think that there can't be many that are more important than the degree to which we as citizens and we as human beings are committed to the advancement of that basic principle.
And here's the event you just mentioned, and that is a symposium on Monday, the
December 16th.
Tomorrow.
Yes, tomorrow.
This is airing Sunday, tomorrow. a Political Drivers of Health Symposium, Power, Politics, and Prosperity. That's the title, right?
That is.
And Dartmouth Health sponsored the symposium, December 16th, 8 o'clock to 2:30. St. Anselm College, Manchester, open to the public, and it's free.
And it's free.
My thanks to Courtney Tanner, Senior Director of Government Relations at Dartmouth Health, and to Bob Dunn, Director of Public Policy at the Roman Catholic Diocese of Manchester, including Catholic Charities. Nice to have you. And if you missed part of this briefing on social, economic needs and health, you can go to WMUR.com, where it will be posted all this week.